Anne McMenamin and her sister have been visiting their father John at his Adelaide nursing home every day for the past 6 years. The 97-year-old has advanced dementia.
We can't give you a kiss, so we'll just have to do an elbow rub. We know that the home is understaffed and that our time that we put in, 2 hours every day feeding, is essential for Dad's well-being.
That all changed last Friday when the lodge, owned by Eldercare, announced it was going into a total lockdown. Anne McMenamin asked if she could continue visiting her father in order to feed him, but Eldercare refused. She fears her father will end up malnourished.
Last year, or just over a year ago, I had a hip replacement. It was Christmas. We weren't able to go in as often as we usually do, and Dad lost 3 kilos in a month.
Eldercare says the lockdown is necessary for resident safety and that the staff are working extra hours to feed residents.
Nice warm face washer.
John McMenamin will have his weight recorded and reported to the family.
Now, aged care. Some very sensible recommendations, and I know these will be difficult.
Last month, the Prime Minister advised aged care homes to restrict family visits to 15 minutes a day. But many of the biggest aged care chains, such as Bupa and Opal, instead announced total lockdowns. Australia's first coronavirus death was at Dorothy Henderson Lodge in Sydney. Since then, 4 more residents have died, with a total of 21 staff and elderly testing positive. 7:30 has been told by the Federal Department of Health that there are now 41 cases of coronavirus in 17 nursing homes around the country.
It's become apparent that a lockdown is essential, that older people are at the highest risk of dying. Those in residential aged care are more likely to get an infection once it's in. So I think a lockdown is the only way to keep the virus out. A lockdown that is so strict that you never see anyone or that there are no exceptions is not what we want. We need a humane lockdown.
Aged care researcher Professor Joseph Ibrahim believes families who provide daily care should be allowed in once they're taught infection control. He worries that with the Aged Care Quality and Safety Commission stopping inspections of nursing homes and no family visits, facilities will face no outside scrutiny.
The danger is the possibility that people will resort to extraordinary levels of chemical and physical restraint, that the residents won't get the care that they need.
The concerning thing for us was, already it wasn't a transparent sector or a transparent system to us, and now we really don't know what's going on.
6 months ago, the regulator declared that more than half of Bupa's nursing homes had failed basic standards of care. Last week, Bupa locked down all of its 72 aged care homes.
I think I got the message at 12:15, and the message was that as of 5 o'clock this afternoon, there will be no more visitors allowed.
Meredy Eastman's 93-year-old mother, Berenice, has been a resident at Bupa South Hobart for 4 years. Because none of the family live in Tasmania, they pay external carers $10,000 a year to visit their mother every day. Despite being trained aged care workers, they too have been banned.
Roxy, how are you today?
Meredy Eastman says the lockdown is taking its toll on her mother, who has dementia.
Yesterday I had a phone call with her where she wanted to get off the phone because she felt she was burdening me with her state of mind and her sadness, and that's never happened before.
Adding to their concerns, last year the Aged Care Royal Commission heard evidence that Bupa South Hobart tried to save money by not replacing absent staff. Last week, Bupa sent a message to families via YouTube.
So to enable them to move around the care home, to interact with their fellow residents, to be able to live as healthy a life as they can, I ask you to stay at home.
But Berenice Eastman tells her family she can't move around the home because she's mainly confined to her room. Bupa carers tell the family that's not the case.
We actually don't know what's going on. All I can say is that it's a bit of a grey area, and our mother definitely is convinced that she's a prisoner and she's not getting fresh air enough.
In a statement, Bupa said Mrs Eastman is not confined to her room and a staff member has replaced her regular private carers to reduce the risk of coronavirus infection.
We may not see you again for a while because the home is not allowing us to come back in.
All families worry about the threat COVID-19 poses to their elderly loved ones, but some fear the lockdown just as much.
Love you, Daddy. There we go, love you.
I have a worry that there may be more deaths as a result of these restrictions.
My fear, and I bet it's the fear of a lot of people whose parents are in these homes, is that Mum will die in there and we won't get to say goodbye.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 730's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.